Our next speaker is a gentleman I've had the chance to meet over the last few years while attending the annual conferences of the National Business Coalition on Health. And in those experiences, I've been very impressed with the direction of the organization, the things that were talked about from the different presenters, particularly in their presentation called their Productivity Forum, and the leadership that is emanating from the National Business Coalition on Health. But today we're here to listen to the president of the National Business Coalition, Mr. Andy Weber. Mr. Weber is a completed his undergraduate education at Stanford University, and today he serves as the president and the CEO of the National Business Coalition on Health. It's important for you to get a better understanding of what that represents. The National Business Coalition on Health is a collection of 60 regional business coalitions that represent 7,000 employers that represent 27 million employees and their dependents. So when we talk about this gentleman representing a coalition, it's a rather substantial coalition and a very important one in the health world and in the business world. Day in, day out, Mr. Weber's activities are involved in the management of the organization, responsible for overseeing all of the association's activities, including value-based purchasing, government and external relations programs, educational programs, communications and technical assistance, research and evaluation for their members. Mr. Weber is very active outside of the National Business Coalition in the broader interface of business and healthcare. He is currently the vice chair and a board member of the National Quality Forum. He sits as a member of the board of the Patient-Centered Primary Healthcare Collaborative, the Alliance to Make Us, U.S., Healthiest, and the Healthcare Incentives Improvement Institute. He is a principal of the Quality Alliance Steering Committee of the NBC, and NBCH is a member of the Ambulatory Quality Alliance. Mr. Weber is also a member of the Purchaser Business Advisory Councils of the National Committee on Quality Assurance, and he is a member of the Joint Commission for the Accreditation of Healthcare Organizations and the eHealth Initiative. Ladies and gentlemen, would you welcome from the National Business Coalition on Health, its president, Mr. Andy Weber. Andy?
Hey, thank you, sir. That was great. Oh, wow. What a very nice introduction. You know, and whenever I hear a nice introduction, I wish my mother was in the room. And I say that because there was an allusion before of the baby boomers, and I'm a proud member of the I was born in 1955, right in the middle of the wave. And, you know, we talked about the baby boomers and all the positive things that they did. Yes, I was demonstrating against Vietnam War. My whole family, except I was too young, was at the March on Washington in 1963. Yes, we challenged the status quo. But as my mother will attest, we also got into a lot of trouble. And picture me as a teenager in New York City in the late 1960s, early 70s, with hair literally down to my shoulders, pursuing a lot of unhealthy behaviors at that time. And you can imagine what some of those were. Anyway, she would be very proud to be in the room to hear that very nice, after all the hell I put her through. I also need to mention my father, who was a Protestant minister. He met Albert Einstein about a year ago, and he would always give me advice about life, and particularly about public speaking. And one of the things that he said is never, ever speak after very good speakers. And so I sort of struck out. Those were 3 wonderful presentations that we heard this morning. And I really want to acknowledge each one of them, both Dee Eddington, Dr. Klum, Dr. Riekman. Wonderful setup And I wish so many of my members, the business community, was out there, because I think many of the themes really resonate with them, as we'll talk about today, as I give you that perspective. The other thing that really resonated for me, and my father would always say, and this sort of comes from, his own career, profession, was, everyone, you don't have to be a minister to have a calling in life. And I just sense in this community in particular that the folks here have a true calling and a sense of service to others, a sense of you want to have an influence and have an impact on what's so important in life, and that is each individual's health and vitality and bringing meaning to their life. So I want to sort of congratulate this community for your calling, and particularly the young people in the audience for your commitment to providing service, which is the highest calling, I think, for any individual. Those were the words of my father that ring in my ears all the time. And so I have a calling too, and I think I share it with you. My calling and my career has been, how do we improve health and healthcare? And that's what I'd like to talk about. And I'd like to talk about a community that I think can be a change agent for improving health and healthcare, and that is the employer community. And if there's any takeaway from what I have to say, it's that the employer community is in the business of health and healthcare not because they have a calling or a moral responsibility, but because they have an economic imperative to improve workforce health and productivity. They have an economic imperative to get better value for the incredible amounts of dollars that they spend in the healthcare system, and they don't think they're getting a great value. And all of those issues relate to their ability to compete in a global economy. So if you take nothing away from this discussion, is think about the employer community as a customer of yours, as a natural partner, because they have such a strong economic interest in improving population health, particularly workforce health. Their dependent, their employees, their dependents, even the retiree community that they continue to provide health insurance benefits for. You have a natural ally, and I think potential partner, with the employer community. And part of my talk today is to really provide a few recommendations on how to approach employers and some thoughts about how you might think about that partner relationship with the employer community. And you'll keep me on time. I know you cut into my time a little bit. I heard all the great noise over there. It sounds like everyone was having a great time. So what I want to quickly do, and I can sort of cut down on some of my remarks, because again, the three great speakers, I think, touched on some of my themes. But the three things that I wanted to talk about was, one, the problem that we've got. And it's a larger problem than to just employers. I think we're talking about our society at large. The employer role in health and healthcare, and again, ending with partnering with the employer community. Dr. Klum mentioned this, I can't go anywhere without at least describe, my board members don't let me do this, without describing who we are. We are a national association, 54 business and health coalitions. We have a vision, thank you, Dee, better health, better care, lower costs, at a community level. Because health and healthcare plays out at a community level. Now, it's not there's no national solution to improving health and healthcare. Each community has to address it separately. And our mission as an organization is to help our members to be change agents in local communities. Here's where we are. We do have a coalition in Georgia. It is in Savannah, the Savannah Business Group on Health, but we're hoping And we're in the middle of beginning talks with some employers in the Atlanta region. And maybe a year from now, we'll have an Atlanta-based business group on health as well. We're hoping for that. So Houston, we have a problem. Jim Lovell, Apollo 13. We are a population of poor health. Dee said it. We're getting worse. The public health community has failed. But it's not the public health community's responsibility. I want to push back a little bit from Dee Eddington. The determinants of health, as we'll talk about in a second, are very, very broad. And getting to better health is a team sport. It's not just, let's give it to the public health community and they'll solve it. That will never happen. We rank, as a country, 37th in the world in healthcare status. And yet we spend so much more on healthcare than anyone else. We have poor quality, indifferent quality. This is the famous RAND study. Doctors provide appropriate healthcare about half the time. It's a coin flip. Some of that driven by the nature of uncertainty in medicine, but some of it also driven by the fact that often appropriate care and the right thing to do is not disseminated quickly. And it takes usually 17 years for the system to adopt to appropriate care science. This is the Dartmouth Atlas. Jack Wenberg was the one that told us about the incredible levels of medical variation in this country not explained by underlying population risk factors, but explained more by organizational and medical industry dynamics. Where you have more hospitals, more specialists, you tend to get more healthcare services. He also told us about supply-induced demand, the inequality of the information gap between what consumers know about health and healthcare and the professional knowledge, which so often dictates the provision of healthcare services. Jack Wenberg, I remember well. Clem Beazold is in the room. Where are you, Clem? There you are in the back. It was Willis Goldbeck. When I came to Washington in 1978, went to work for Willis at the Washington Business Group on Health, and I remember it like it was yesterday, Clem. Willis walks into my room, slaps an article on the table, and it's Jack Wenberg's article on medical practice variation in Scientific America. And I was just out of college, and I had a political science degree, and I think most of the public thought that healthcare was a science. That there was a lot of certainty, that it was black and white. And he gave me this article, and I was just flabbergasted by, again, the research on the level of medical practice variation, reflecting a lot of issues, but again, the level of uncertainty in medicine, that it is not a black and white science. So we have poor health, we have uneven quality, and it all leads to healthcare costs far exceeding the general inflation. And our international comparison, we spend 50% more than the next nearest country on a per capita basis. So here was a speech of President Barack Obama. Today we are spending over $2 trillion a year on healthcare, almost 50% more per person than the next most costly nation. And yet, as I think many of you are aware, for all of this spending, more of our citizens are uninsured, the quality of our care is often lower, and we aren't any healthier. I think it's a pretty good summary of the problem we have. But, and the Japanese would say this a lot, every problem is a pearl in the sense that it identifies opportunities for improvement. And there is hope. And there is evidence in this country, in communities all over this country, and even at a state level, that we can get to better health, higher quality, at lower cost. And this is one of my favorite slides. This is Medicare data. On the vertical axis is high quality, so you want to be a state that's up in the upper left-hand quadrant. And then on the horizontal axis, you have per capita expenditures out to $8,000 a year. This is pretty old data, but I've seen more recent data, and the statistics have not changed, nor have many of the states changed where they fit. And what you find out from this data set is that where you have the highest quality care, you actually have the lowest per capita expenditures. We can get the higher quality and better healthcare status, I think, for Americans at lower cost. And that, I think, is our challenge. It is the triple aim. This is it in a nutshell. This is the strategy. How do we get to population health improvement? How do we transform the healthcare delivery in all the ways that we've been talking about today, so it is not a system of just responding to illness, but it is actually investing upstream in the maintenance of health, in reducing risk factors, in better management of chronic care, particularly on an ambulatory setting? How do we transform that healthcare delivery system towards better quality, greater efficiency, and an orientation towards the maintenance and production of better health, which, as everyone in this room knows, we don't do. That's not the culture of the healthcare delivery system. If we do that, that's how we get the cost containment. Better health, better care, lower cost. Don Berwick coined the phrase. We've been talking about it, within business and health coalitions for 30 years. That's the vision. That's where we want to get to. And I guess the question for all of you in the room is, what's your role in getting to this end goal in terms of healthcare transformation, better health, and lowering costs? So that's the problem, and now I want to talk about the employer role. And again, as I said at the beginning, I'm convinced that employers, with the right senior leadership that Dee talked about within organizations, can be a change agent and can really influence getting to those end goals. And if we think of the end goal as starting with improving population health, then we also, and it was alluded to again this morning, I forget who did it before, if health is our end goal, we need to understand that health care actually is a very small influence on healthcare status. I think, Jerry, you talked about that. The other factors that are so important and that employers can influence, the slide is up here because employers can be a powerful influence on all the key determinants of health except genetics. No one can really impact genetics. But take genetics aside, the employer community can influence all the other key determinants. What is the most important single factor in predicting better health? Anyone know? One single factor that is greater than any other. It's socioeconomic status. It is income and education level. Income and education level. So in a way, if we're serious about, if health is our goal, healthcare status, and again, I challenge you, everyone here, if healthcare status is our goal, then what's our investment in improving the socioeconomic status of the population? That will have more influence on health status than anything that we do in the healthcare delivery system. It's the greatest predictor. We're trying very hard. We've got some projects going with some of our coalitions to get more involved in public education. Not only because public education is a factor in terms of knowledge base of our workforce, but because it is, again, a health determinant. We've talked a lot about individual behaviors. Healthcare status has more to do with diet and exercise and not smoking and drinking responsibly and having meaningful relationships in one's life. That's the second most important factor. And then Dee talked a lot about, and this is the first time I've heard him particularly talking about it at a community level. Dee talked a lot about environmental issues. By the way, employers can influence individual behaviors because they've got a captured workforce. 8 hours a day. They can build an environment. They can create incentives. They write the paychecks. They can provide information and messaging that can influence individual behaviors. They can also have an influence on environmental factors as well. And at a community and population level. The one that I love to talk about in terms of environmental factors is, again, back to the baby boom. We baby boomers, 80% of us, when we went to school in the 50s and 60s, guess what? We walked to school. 80% of kids walked to school. Today, you know what that percentage is? Anyone care to guess? No, it's better than zero. It's 25%. 25% of kids walk to school. So again, there are these environmental issues. There's the healthcare delivery system does have an influence. And again, I'm convinced that the healthcare delivery system transformed, in particular, could have a greater influence on individual behaviors. And that's what you guys are about, too. You're about lifestyle changes and diet and exercise as part of your a bundle of healthcare services to individuals, which is very appropriate. The story I love to give on this one is, and we had him as our annual conference speaker a couple of years ago, was Governor at the time, Mike Huckabee. Actually, he was running for the presidency at the time. And you probably don't know this about Governor Huckabee if you just see him today on his Fox TV show. But when he was governor of Arkansas, he was obese. I mean, 300 pounds plus obese. And he came to our conference, and he didn't talk about running for the presidency. He gave a story of his own personal health care journey. And Southern politicians, they're the best story takers in there. I mean, you could have heard a pin drop when he was talking. And I'm not commenting on his politics here at all. But he started his healthcare journey with, I sat down with my primary care physician. I came in for my annual examination. And after the examination, my primary care doctor, who I had been seeing for years, and I really respected the guy and I trusted him, he looked me in the eye and he said, "Governor, you have another 10 years to live. Unless we make a decision together, and I'm gonna be here to help support those decisions, not provide all the ancillary services that you need in terms of diet and exercise, but let's make a commitment today to radically change your lifestyle, because you can live a long, healthy life. But you've got to be committed to individual personal behavior change. And I want to create, from my practice, much like you're trying to do in your own practices, I want to create a supportive environment for you. And I'm going to do some things that most primary care docs don't do, and that is I'm going to call you on the phone and follow up and ask you to come back and check in with your dietitian and see how you're doing on your exercise. And he said that was the start of my journey. Having that trusted, professional who really cared about me say those things to me was the start of my journey. So the point here is simply, if we transform the healthcare delivery system in the ways that everyone's been talking about, the healthcare delivery system could have more of a profound impact on overall health status, rather than just being a system, as we've all talked about, that just provides acute care services. And again, employers are also important because after government, we're the largest purchaser of healthcare services. So we are an important influencer. The question I get asked is, Andy, you talk a good story about why employers should be involved, but so often they're not. And it is true. I mean, the level of C-suite commitment at an organizational level to improving health in healthcare is not what it should be. And again, some of the factors that go into this, I just wanted to sort of outline. Unfamiliar territory, it's not our business. We make widgets. The few times I get to talk to CEOs and sort of make this pitch, and at the end of the day, they come back and say, Andy, you got to understand, I get up every day with my C-suite to figure out how to make my own product competitive in a global economy. You're asking a lot for me to be the source of influence, the change agent, particularly in transforming the healthcare delivery system that is so large. Other issues, competing interests, many employers in the business of healthcare, we've been over-reliant on other so-called trusted partners like healthcare plans and benefit consultants and brokers and PBMs, and have not taken on our own responsibility. And when we're focused as a company not on health and healthcare as a business imperative, then that culture eats strategy for lunch, as Peter Drucker, I think, said. And this commitment really needs to come from, I think, the C-suite. We're also to blame. We love pointing fingers at everyone else, but we're also to blame for some of poor health in healthcare, for stressful work sites, unhealthy products, obviously. We're a big finger at us for the crazy, toxic incentives in the healthcare delivery system, a system that pays for volume rather than outcomes, fee-for-service medicine. You do more, you do better. We pay for individual units of care rather than thinking of the individual holistically and thinking about payments, bundled payments at a whole episode that would encourage greater integrated management of a patient over time. We pay for acute care, not prevention, as everyone says. Incredibly to business people, we pay for routinely medical errors and do-overs that could have been prevented. Someone comes into the hospital, gets a hospital-acquired infection, has to stay longer. The bill goes up, we pay no questions asked. Would we do that in any other sector of our economy where you pay more for something that could be prevented, wasn't provided well with poor quality, and led to a do-over? With no performance-based payment. And we've also been responsible, I think, for developing this consumer entitlement mentality. This third-party payment system that insulates individuals from bearing the consequences of their own demand when they think they're spending someone else's money. Guess what? Demand for services are quite different. And it's interesting, one of the more interesting strategies that employers have been developing out of economic necessity, but also because there's some theory behind it, is that we've got to have individuals with a little more skin in the game. And I was talking to a few people that are saying, some of these HSA and reimbursement accounts that individuals have that actually the employee is feeling that it's their own money and they can use it any way they want, including to buy for services that typically aren't part of most insurance coverage, might be a very good thing to free up innovation and the sorts of services that this community can provide over time. Anyway, employers are to blame for some of this, and we've got to correct it. So at the end of the day, what do employers want? And I get asked this question more than any other by healthcare providers, by vendors, by consumer advocacy groups. And I've tried to distill it down to two major things, and Dee said it. We've talked about it. Improved workforce health and productivity. There's a direct connection, and health and productivity can be a competitive advantage. And the more thoughtful, cutting-edge employers have really understanding that. And then we want greater value for each dollar spent on healthcare services. We are spending, $1 trillion providing health insurance benefits to 160 million employees, and we don't think we're getting the value for our dollar spent. So, and both of those things, as written here, impact competitiveness and the bottom line in a global economy. So we want workforce health, and we want better value for our dollar spent as the goals that we have established. How do employers get there? I think there are two overarching strategies. One is population health improvement. Think of the work site as a defined population, the workforce as a defined population. And the interest of the employer is to improve the health and productivity of that defined population. In fact, the cutting-edge employers build whole teams, health management teams, that are responsible with good metrics over time, making sure that the health of that workforce globally across the world improves in terms of healthcare status. That productivity and health is getting better, and it's measurable. And so this is sort of like a provider function. Employers are providers. They're sort of like, mini Kaiser systems. And they're looking for partners, providers, that can assist in introducing strategies of population health management. As Dee said, starting with maintaining health, and perhaps he's right, we haven't focused enough attention there. Reduce health risk factors, and then manage illness because some people do get sick. The second strategy is value-based purchasing. How do we get better value for our dollar spent? And here the strategy is, can we measure, make more transparent, and reward quality performance? So think about that. Think about that from your own perspective. What role do you have to play in population health improvement? And what role can you play in demonstrating, so it can be rewarded, your quality performance, particularly in comparison to other healthcare providers? Because again, I believe purchasers of healthcare are looking for high-performance providers in the system, and they're willing, again, to measure, report, and reward better performance in healthcare delivery. The third point I want to make is that, and Dee alluded to this a little bit, but I wanted to reinforce it, is that these strategies need to be applied at two levels. First and foremost, it needs to be applied within the employer organization, at the work site, to build organizational cultures of health, to again be good value-based purchasers of health care as an organizational mission and responsibility. And here we've seen a lot of the trend line is going up here. in terms of more and more companies, I think, developing strategies of, again, population health improvement and value-based purchasing applied within the organization. And this is where employers, quite frankly, are most comfortable, they're the most active, they feel the most in control. And business people like control, let me tell you. But the other point, and the big leap that employers, I think, need to make, if they're really serious about population health improvement, if they're really serious and understand that you can do everything right at the work site in terms of being a positive influence, but if your workforce then enters communities where there are poor schools, no parks and recreation, unsafe streets, food deserts, nothing but husband and wife saying, hey, pick up something from the fast food so we can quickly feed our kids, and by the way, it's cheap, convenient, and the kids are very happy with it. If that is the culture of that community, then you can be doing everything right within your organization, but your investment is going to be compromised if you're not also thinking about those same issues, population health improvement and value-based purchasing to really move a different and transformed delivery, if you're not thinking about those issues at a community level as well. It's big to ask employer leadership, C-suite leadership, to get involved at that level. And this is why our business and health coalitions, I think, can play a very important role. A lot of our portfolio of activities is community-wide strategies, both in population health and in value-based purchasing. I don't have time to share with you examples of that. But it's a big leap. Employers are less comfortable, active, and in control. It's a tough argument to make, but it's one that I would like to make more with the employer community, and I'll leave with your own community too. Think about not only the provision of services to the individual, but think about how your industry, your profession can have an impact on community health dynamics and building a culture of health at that level as well. By the way, I think the themes of value-based purchasing and population health, and I know tomorrow you're going to be having a tutorial on healthcare reform, but the only comment I wanted to make here is that I think the themes of population health improvement and value-based purchasing line up well with the provisions of the ACA legislation, healthcare reform. Most of the headlines have been around coverage issues and all the health insurance reforms. But embedded in that 1,200 pages are a lot of very interesting provisions that relate to, I think, again, more healthcare transformation and value-based purchasing. And here are just a few. Encourages delivery system models, accountable care organizations, and medical homes for population health improvement, which I think we should support. Directs Medicare to become a value-based purchaser. Medicare is now on a path, and providers have heard this message from Medicare through the ACA legislation, that we are going to fundamentally change how we reimburse in healthcare. We're going to move away from fee-for-service medicine. We're going to be experimenting with pay-for-performance, bundled payments, more global payment arrangements. And that is written into the law in terms of the future. It establishes major new investments in community-based health improvement, the Public Health and Prevention Fund, multi-billion-dollar fund, and creates some mechanisms and funding for public and private partnerships through this little jewel that got Don Berwick to CMS, and that was the creation of the CMS Innovation Center, that again provides and frees up a lot of dollars to support aligned activities between the public and private sector. So, healthcare reform, as Joe Biden said to the president, you can read it, it is a big deal, but actually the point I wanted to make is, yeah, it's very important. But I think what's more important is, again, what happens here in local communities. I believe that any transformation has to come from the bottom up rather than the top down. And when I think about health and healthcare transformation, I think of a team sport. I think of it at a community level. I think of the need for everyone within a community, all the major stakeholders, to get around a common roundtable and to be thinking about some cascading strategies. One for community health improvement with the community, one for care delivery, transformation and improvement, with the delivery system having so much to learn from one another. And I think employers, government, consumers, healthcare plans need a new way of thinking about paying and rewarding performance in healthcare. So this notion of a value-based purchasing council. Again, just a sort of vision of how different stakeholders might come together at a community level if we're going to tackle this issue. The main point here is, it's not, I get worried that we're all distracted by healthcare reform and the Supreme Court and the politics of it, and we almost are waiting around for what's going to happen when the job of improving health and healthcare happens every day, and it happens in local communities, and it happens when everyone understands their role and plays a part in getting to the solutions. So, let me end. How am I doing with time? I'm doing, okay. So I wanted to end with just a few thoughts, now that I've sort of teed up the problem, teed up why I think employers have influence, why they have an incentive to get involved in health and healthcare, what their strategies are. I wanted to just say a few words about and some recommendations about partnering with the employer community. And I hope we'll have some time for dialogue, too, and questions around this. The first thing is, establish employers as a core customer. It would be very interesting for this community that is so focused on population health improvement, getting more upstream, to sit down with an employer and talk about the challenge of taking that workforce and developing strategies for population health improvement, and the role that your profession can play in helping employers to improve the health and productivity of their workforce. So my challenge to you is that, have you thought about employers as a customer? And have you thought about, again, an outreach strategy, a marketing strategy? And here, my second recommendation is aim high. Yes, talk to HR and employee benefits. They're often the champion. But to the degree that you can make a case to the CFO, the degree that you can make a case to the C-suite about your contribution to improving health and productivity and your role in population health improvement, I think you'd be doing a great service. Internalize and always relate your message to the employer community's broad strategies and goals. In any business partnership relationship, understand the customer needs. Understand what their goals are and talk their language. And again, I think you have a good story to tell in that regard, because I think what you do is very much aligned with what employers want. At least some more enlightened employers. So here we get a little more granular and tactical. Build partnerships and integrate chiropractic services into employer worksite-based health management strategies, on-site clinics, disease management initiatives, health promotion programs. There are employers all over that are building an infrastructure for population health management, have on-site clinics, how are you relating to that infrastructure that is being built within companies right now? Are chiropractic services built into on-site clinics? Or at least is there a conversation within the health promotion folks that are working in companies about appropriate referral to your providers and your services in the community as part of that, again, worksite-based health promotion wellness programs where, again, companies are investing a lot of dollars. Also think about the transforming healthcare delivery system. And again, you'll hear more about the details tomorrow, but think about the possibility of integrating your services into the emerging new population health delivery models that are encouraged by the ACA health reform legislation, particularly the medical homes. And congratulations for getting community health teams sort of married up to the medical home idea, and particularly related to accountable care organizations, because those are two delivery models where the rewards, the reimbursement, the delivery system needs to build infrastructure and capacity to manage populations. And if you could bring to those organizations your services and a strong message that, again, you can provide value to get to those end goals, I think there could be some creative partnerships built. Help design and support new provider payment models, bundled and global payments, shared risk arrangements. This is the value-based purchasing innovation that is going on right now. And again, once again, it's encouraged by the ACA legislation. Another value-based purchasing strategy is using benefit design, a concept we call value-based insurance design or value-based benefit design, where more employers are thinking about ways to actually encourage the use of high-value services. We do that by lowering copays or waiving copays. Employers are doing that for clinical preventive services or even, some chronic care conditions and services. So help us design and support. And I think you shared with me, too, a study from Value-Based Innovation, Cindy Nair's group, on thinking about value-based insurance benefit design models that could relate to your profession. And those incentives could include this whole idea of trying to steer or encourage people to go to high-performance provider networks. And again, systems that are more accountable for population care management. Understand that employers, as their customers, can influence health plan strategies. I know the frustration you've probably had with third-party payers. Who are the customers of health insurance plans? Who can influence health insurance plans? Employers can. So think about the employer's ability to influence the healthcare plans that administer their benefits as a strategy, particularly if you've got concerns or you feel that coverage decisions or even being part of basic third-party payment coverage has been unfair or inappropriate. Demonstrate value by more published data and research. The Milstein study, I think, was a great example. Include in those studies, as Dee talked about, productivity metrics in your impact analysis. This will significantly boost ROI. If you could demonstrate that the provision of services not just reduce downstream use of emergency rooms and hospitals, but actually impact productivity measures, like absenteeism, like presenteeism, like disability costs, then I think you're going to have a very powerful and much more significant ROI impact studies. And finally, always work with an employer-led health coalition if one exists. And as I said before, think about more involvement at a community level, particularly in influencing the other determinants of health status. You guys are in the healthcare business. But if you're in the healthcare business, you need to take a holistic view, that it's not just about healthcare services, it's about all those other influences on healthcare status and population health. So, some closing thoughts. Even with passage of national healthcare reform legislation, genuine reform, better health, better care is a community dynamic. No one is better positioned to influence and to benefit from improved health and healthcare from the employer community. That's why I've been trying to work with employers over the last 10 years and started out my career there. And employers, I do believe, are a necessary, if sometimes reluctant. I want to raise my hand. Not all employers get it. We're fortunate within business coalitions to work with employer members that do get it, that do join and are working together and trying to learn from each other within the coalition model. We're very fortunate that we're again, aligned with cutting edge, but not all employers are there. But I think they can be, again, a tremendous change agent. So, yes, we can build a culture and conditions for population health improvement. Again, I do want to, as Dee emphasized, say that culture and environment, creating the conditions for people to make better choices. Let's not just put all the responsibility on individuals and their individual behavior. Let's create cultures and an environment so the better health decision is the easier decision. You know, an easy example is healthy cafeterias at the work site, where the healthy nutritional food is subsidized and the hamburgers and French fries are off the menu or they cost a lot more than the salads and the healthy nutritional foods. And what if we did that in schools and in other community institutions? Re-engineer, or better yet, transform our current healthcare system. I'm singing to the choir here. You're part of that transformation. Build community-based collaborations and partnerships for meaningful change. We do need a dialogue with everyone that relates to health and healthcare, including traditional practitioners, the traditional delivery system. And I'm convinced that we can save healthcare dollars. If we do those things, we can save healthcare dollars to dedicate to other societal needs and to enhance our global competitiveness. So with that, I'm going to stop. I don't know whether we have any additional time. I want to thank you all for listening and for the invitation. I've enjoyed very much being here. And good luck in meeting the challenges ahead. Thank you.